call upon stage Dr. Bhanu Priya for a talk on Dexamethasone implant in silicone oil filled eye.
A very good afternoon. Today I am talking about Ozurdex implant in silicone oil filled eye. So as we know, silicone oil is the main choice of endotamponade in complicated VR surgeries, and there are macular edema cases after vitrectomy has been reported with an incidence of 5.5 to 47%. So macular edema in silicone oil is somewhat different because there is accumulation of cytokine and growth factors. Sorry. So there is accumulation of cytokine and growth factors in the retrosiliconous space, which contribute to severe and long-lasting macular edema. So the treatment options for macular edema is either NSAIDs, topical steroid, or intravitreal timeslow acetate. But in silicone oil filled eye, it will not be able to manage because silicone oil acts as a barrier for the therapeutic drug to reach the retina. So the other option is either removal of silicone oil, anti-VEGF injections, or dexamethasone implant to tackle the inflammation. So I am going to share about our cases. So this was a 33-year-old female with uncontrolled diabetes presented to us with bilateral PDR with right eye vitreous hemorrhage, and the vision was hand movement. On BA scan, there was tractional retinal detachment was noted. So we went ahead, did a VR surgery with silicone oil, 1000 century stroke. Patient was happy, but after 2 months of surgery, she developed macular edema and her vision dropped. So we went ahead and give Ozurdex, and within 4 weeks, there was anatomical improvement, but functional improvement did not improve much, and the IOP was within normal range. So this second case of 58-year-old female with bilateral lizard PDR, there was history of multiple injections, and she presented with right eye vitreous hemorrhage, and the visual acuity was finger counting close to face. So we went ahead, did a surgery. She was maintaining visual acuity of 6/36, but after 2 months, she again developed macular edema, and she was very unhappy with the visual acuity of 6/60. So we went ahead and give her Ozurdex. So after 2 months, she did improve with the resolution of macular edema, and the visual acuity also improved by 1 line. So in our case, the macular edema appeared around 2 months of the VR surgeries. We used 1000 century stroke of silicone oil. There was resolution of macular edema, and there was improvement of visual acuity also. So we also did not noted any rise in intraocular pressure, but there is some thing they say that this Ozurdex implant is given by the 22 gauge. So there is some cases reported with when they give the silicone, they give Ozurdex, there is seepage of silicone oil in the some conjunctival space, but we did not see any sort of thing. So we thought the Dex implant can be used as a first line treatment for macular edema in silicone oil in situ eyes. There are very few articles who have highlighted this dexamethasone implant in macular edema under silicone oil. So this is the one article who have given silicone oil after there was persistent edema and despite using the topical NSAID and steroid treatment, they did use 5000 century stroke for the endotamponade, and they also concluded that dexamethasone implant can be used as a first line treatment, and there is no need for the early silicone removal because redetachment, resurgeries have more complications also. So dexamethasone implant behave very differently under silicone oil compared to the BSS. So there is this is another article which have highlighted the in vitro pharmacokinetics behavior of the dexamethasone under silicone oil, and which resulted that Ozurdex in the 1000 century stroke have more inhibitory effect compared to the denser media. So the take home message is Ozurdex implant is preferable alternative for macular edema under silicone oil filled eye, especially in the diabetic cases where inflammation plays a very important role. Thank you so much.
I thank you for that very interesting case series. So, a question from the panelists?
What precaution we should take when to inject Ozurdex in silicone oil filled eyes,
Ma'am, one
so that there is no leakage?
Yes, ma'am. So first is the direction of the how you give the Ozurdex implant, and other thing we should have an standby sutures also. If there is a silicone seepage, we must suture that port area. So we do not have that silicone seepage or post-op hypotony also.
Okay, that's nice. One question I had for you. So we did not have any control group here to compare with. So we do not know what the natural history of such an edema is, whether it resolves on its
Yes, sir.
own, whether the oil is the culprit here. Maybe oil removal would have helped. So
Yes, sir.
any
We
idea?
need more data on that. So we'll try to give more.
Yeah, so it is
results on that
a
also.
novel approach, and patients who can afford this implant, they
Yes,
can
sir, yes, sir.
undergo it.
Since the first patient was 33-year-old engineer girl, she was very anxious. So we with bilateral PDR, so she was very anxious. So we must need to do something for these patients. And again, if there is one-eyed patient, if the better eye is there, so we need to do something. So the best vision we can give. So
Yeah,
we have to go
that
for
I
extra
understand.
lens
Yeah.
in these cases.
So there is
also.
another option that you could have tried, a posterior subtenance. That is a high dose, and that also helps in such kind of a cystoid macular
Yes, sir,
edema.
definitely, sir. This is another
And
option.
it
I will
might
try
be
to
more
do
cost effective.
in other
right?
cases also. Thank you
Okay,
so much.
thank you.
Thank you, sir.